So welcome to yet another talk, another chat with another amazing doctor, plastic surgeon of aesthetic medicine and surgery in this special Infinity Podcast at TAMC 2025 here in Dubrovnik. I am, of course, talking about a guy who I fell in love with, to be honest, when I saw him once many years ago at an IMCAS Congress in Paris. And it was a talk where he was talking about the symmetry of the face. Because we used to talk about how you have to be symmetrical to be beautiful. And he was doing split face slides where he showed that actually that's not good. We have to be uneven. We can't be completely symmetrical. So yes, this amazing guy is my great friend who's been coming to TAMC for many years. It's the great plastic surgeon, Jonathan Sykes. Jonathan, so nice to see you here.
Thank you, my friend. Again. Thank you, my friend.
So nice to see you again. A real pleasure. Last year, unfortunately, you couldn't make it, although you really wanted to. You already had a flight booked to come and see us. It's such an amazing, and I think that's what I love about this industry and about this Congress. It's the friendships that I've made. And I'm humbled at the loyalty of greats, world greats in your industry, that you keep coming and you want to be here. I know you're here instead of being at a plastic surgery summit somewhere else, but you've chosen to come and join us.
That's correct. We're the European Academy of Facial Plastic Surgery, and I'm a part of that, is being held in Dublin. So I actually stopped in Dublin for one night to have dinner with a couple of friends that are there and came to you because of my connection with you in this course.
Yeah, thank you so much. And Jonathan, I'm sure in the years to come, we'll even develop TAMC even more together. So tell me, these days, do you do more of the non-surgical, the surgical, or do you combine?
I do some of both. Obviously, when a patient comes to me and wants to make large changes that last for years and years, I do surgery. And I still actually like doing surgery a little more, even though more people by quantity ask for non-surgical things because people are a little afraid of surgery. They want minimal downtime. They want all of this. But I can make the biggest changes in someone's face. Someone has generalized aging. We think we're going to fix them by putting a little filler in their cheeks or some toxin. And that does make them better. And if they're happy with a small improvement that has not a huge lasting, that I think non-surgical things are the way to go. On the other hand, I commonly do a number of procedures at once: a brow lift, eyelid surgery, a deep plane face and neck lift, sometimes a lip lift, sometimes a rhinoplasty, with all those things, and often with laser surgery at the same time.
Oh, you do laser surgery at the same time?
I do, yeah.
Like some sort of a resurfacing laser? Or
I do. I use the TRL, which is an erbium that allows fairly deep penetration and change with very little chance for problems and complications.
Yeah. What do you say about these, there's always been this controversy. People will say non-surgical is better, surgical is better. I think you're right. The combination, certain patients, I'm sorry, even though I think I can solve most things non-surgically, as you know, I'm a passionate non-surgical aesthetic doctor. Some things you really can't. You've got to send to your esteemed colleague who's going to do that. But we keep seeing on Instagram and online these very, promises of results which seem to be too good to be true. We've even had a few of these big Hollywood stars recently, didn't we, who seem to look almost too good. They almost look like they're 30 years younger. Who comes to mind? Kim Kardashian's mum. What's her name?
Yes.
What's Kim Kardashian?
Jenner. Kris Jenner.
Kris Jenner. There's been a few of these. Are these true results? Is this just an effect because it's still swollen at the time when we see them? Can you really get such amazing results with surgical facelifts?
Yeah. I think you can get amazing results with surgical facelifts when done on the right people. And obviously we see someone like Kris Jenner, who in the after picture has perfect makeup and perfect hair. And we only primarily saw one view.
It's true.
We're all thinking of one picture that looks phenomenal. And I have pictures like that all the time. But I think it speaks to another thing that is very important in the aesthetic industry. And I think it crosses minimally invasive to the most invasive surgery things. And that is practitioners are not telling the truth often. And they don't really care if it's not honest because it's economically the thing that feeds them patients. If you can get a result like that you don't have to show the exact result, the same position, the same lighting, because we can fool the public. And commonly, I see people on Instagram lying about who they are and lying about what their results are. And I don't use I'm not trying to indict others, but I've actually gone on Instagram and talked about what I call deception in plastic surgery. We're even dishonest about what we call things. For instance, I've done lots of rhinoplasties in my career, and I love the rhinoplasty surgery. I love the results of it. I love how it can help function. But what are we doing now? We're calling something preservation rhinoplasty. We're really not preserving things. In fact, in some cases, the dissection is greater. We're preserving one little thing at the junction of the upper lateral cartilage and the septum. That's the one preservation thing. But we're calling the whole operation. Now, plastic surgeons want to call facelifts preservation facelifts. They're doing very aggressive things. And they want to talk about things that are really almost deceitful to the public. And I think we've gotten into this arms race on social media about what we want to show. It's a very interesting phenomenon that talks about what I think is greed in everything. We have this in society.
I think greed, that you said, I think people are greedy. They want to get to 100,000 followers, 200,000 followers, 300,000 followers.
Because that means money for them.
It means money for them.
Yeah, followers mean money.
Yeah, it's like my great father, as you know, and my father was one of the greatest plastic surgeons in the world. He was great friends with many of the greats in the United States, and he was one of the best rhinoplasty doctors in the world. And he always used to say, the doctor who's only driven by money and will treat the patients just driven by money, he'll be a failed aesthetic doctor. I think we're artists, we're scientists, and we have to do what's best for the patients, and we have to do it in an artistic way. I think money we have to put aside. You know, we always do before and afters in the same lighting. We always try to make it true. In fact, I often joke
same
with
position, same lighting.
Same position.
Yeah, sure.
I often joke with my patients that often when we've done, I don't know, the double chin, actually we've done the picture before like this. We've actually done the picture after like this. So we've actually done like a disservice. Yeah. But I think it's a big problem. Is there a big problem in America with illegal people doing surgery and non-surgical things? Are there?
I think that happens a bunch, and I think it happens where people that are non-medical practitioners are injecting things that they get online, and it's forcing companies to make money. Everybody thinks about the dollar, and I think as a doctor, I try to think about the patient first. I try to think about what their wants are. Yeah. For instance, I do a lot of transgender surgery.
You do?
I do a lot of it.
I've seen you talk about that actually.
Yeah. And
is that becoming more popular?
It's becoming more popular, and it's actually hard for me to relate to that. We all have our own, but it isn't important that I relate to what the people want. It's that I try and give them what they want, unless they're asking for something really strange. Yeah. But if somebody wants a much smaller nose, or they had a masculine brow, and I'm changing the contour of their bone, and one of the reasons I like the surgery is I get to work on bone and soft tissue, and I get to do sort of everything and a lot of procedures at once. It's hard for me to imagine why somebody would want to change that, but it's not important that I understand. I accept what they want, and I try and communicate with them to get them the best result.
We have to listen to them.
Yeah,
Exactly. We have to listen to our patients. Tell me about the deep plane facelift. I'll tell you why I say that. TikTok and Instagram are incredible, aren't they? We spoke about Kris Jenner earlier on, and everyone then believes it. CO2 has been the big thing. Of course, CO2 lasers have been, the technology has been around for many, many decades, but people think it's a new thing. The deep plane facelift, I've seen plastic surgeons such as you argue whether the deep plane facelift really is the best type of facelift or not. Well,
just as a disclaimer, I think it's the best procedure. Maybe I'll talk about that during the conference here.
Good.
But I think it's from a technical standpoint, the most logical procedure. But I started doing deep plane facelifts 25 years ago. And in fact, they were a little unpopular then because people heard, and this goes to show what advertising and media does to what people's wants are, what they want. They really want the best result. So I started doing it 25 years ago, and people heard the term deep, and that associated them with invasive.
Yeah, exactly.
And they didn't want invasive.
They didn't want deep.
Right. They didn't want deep. Can you do
something more superficial?
Yes. Can you do a mini lift? I always say, people would say, "Can I do a mini lift? Can I do a micro lift?"
Yeah.
And maybe if I had a nano lift, they would like that. Really, what they want are the results. That's what people want. And to me, I'll explain this during a longer lecture, but this is what makes anatomical sense to me. But what happened is, because of a couple of surgeons who got very good results and championed the deep plane facelift, it was social media that changed the whole dynamic of what people asked for. Now, the same people that were saying, I don't think I want the deep plane lift, or they were deep plane, they're saying, you only do the deep plane lift, don't you? Right? And that's just what they want. The reality is, what you want is an experienced surgeon, and unfortunately, because of my age, I'm quite experienced. About to start my
25.
About to start my 40th year, and doing this.
Don't talk about that.
Yeah, right.
You look great,
right.
by the way. Every time you come to TAMC, you look better.
Yeah, I feel great. But I think social media has changed the whole dynamic of the way we practice, the way we interact with patients. Some of it's very good. We're able to educate them well, but some of it's not so good because there's no rheostat. There's nothing that says the way we educate them. Nobody's there and we're able to say things that aren't true, and nobody says, you've got to take that down. That's not right. This isn't like a paper where they referee it and judge it. We get to put whatever we want there.
Yeah. Tell me, because obviously a lot of our audience will even want to know about non-surgical treatments. What are your favorite non-surgical treatments? Of course, we've got the toxins, hyaluronic acid fillers, a lot of biostimulators now, lots of laser stuff. What do you prefer?
Well, I inject toxin and filler and biostimulators a lot, and it's probably in numbers well over half of my practice, but it's not half of my revenue, but well over half of my practice. And I think there's been an education thing in practitioners with that. First, we were learning about the products and then we were seeing they can do a lot of things. And then we started to overdo them. And now there's more education about not overdoing them, not injecting too much, making people look too unnatural, because the products that we thought might be gone in 6 months are there for a long time. Yeah. We're learning about that. And there are more complications. I remember I had a patient present to me in 2003, and that was the year that actually Restylane was FDA approved in the United States. Yeah. The first one. The first filler, and the person had their lips done, not by me, and came to me because of infection and what looked like tissue necrosis.
Oh, seriously?
And they were sort of scabbing. So in 2003-04, what did I think? I showed these pictures to many smart friends of mine. I thought that it was herpes. And it was clearly a person with vascular insufficiency, and she was a smoker, and she had, but now everybody knows about this with filler. We all know about this, but in merely 20 years, we've gone from unknown. I asked colleagues and nobody knew about it because not that many people were injecting this and having those complications. They weren't having lumps and bumps. They weren't having lymphedema, all the things that we know about. And now we look at how to prevent them. We look at the anatomy, we look at, and so obviously I give lots of courses in anatomy to practitioners.
I was going to ask you about that actually, because I know that with all that experience, all those 100 years in aesthetic medicine, and with your great knowledge, you run your own academy, right? Your teaching academy.
I do. It's called Sykes Face Sculpting Institute, and I usually try to do small, intimate courses with about 10 or 12 people where I teach them anatomy. But not just that. I think it's always interesting that some of the people that are trying to teach anatomy don't know about patients. They don't know. I try and make it have an immediate bent on what the anatomy looks like this, and that's caused ptosis. And you have ptosis of your eyelid, and compensatory brow lifting. All of the above. I try and teach them the complex of what we see. So that's what I try to do.
And you just do them in the USA usually?
I've done them in other countries, but because I'm so clinically active, it's not like I can spend too much time doing them. But I love teaching.
It's just partly why I'm so honored that you come to our Congress every year, because a lot of speakers are professional speakers, aren't they? They're not so clinically active, a lot of the famous speakers. You're one of the ones who you don't go to that many congresses really in the world.
Right. I've actually cut back on it.
You pick and choose, but because we have such great fun and we're great friends, I really do.
I always want to come to this one.
I know, and you have to keep coming.
Yeah.
So what are you expecting of TAMC this year?
Well, good times, good education. TAMP is really, to me, a reflection of you. It's a reflection of you because you're a connector of people, and that makes. I'm connected with some people that I met at this meeting that I hadn't met anywhere else, and now with the ease of doing this on social media, we're connected. And so I have people that write to me because of this meeting, but you do a great job of that, of not trying to make you look important, but wanting the meeting to be as good as it can be. Always getting new speakers, always. So I love this meeting because I learned some things. It's great social fun as well, and it's a combination of those.
Thank you. That's one of the best testimonials I've ever had, I have to say. Thank you so much. We're back in Dubrovnik. We were obviously in Rovinj for a couple of years, which was wonderful too.
Yeah.
We're back here. We've got high expectations, 3 amazing days coming up. So thank you for coming. Would you have any advice to some young, aspiring anatomists, surgeons, aesthetic doctors, speakers at congresses? Any advice to anyone watching? Perhaps they'll be at this congress. How do they become a Jonathan Sykes one day?
Well, for me, medicine has been sort of a lifetime thing that I'm always practicing, learning, trying to make myself my best. I would say, even though it's important to build your practice, it's important to be good at what you do, to be good and safe and to learn, and think outside of the box. If you're an injector, learn about the dental occlusion, learn about eyelid muscles, learn about everything.
Yeah.
If you're a surgeon, don't be closed-minded to think that fillers and minimally invasive things and lasers can't help, because I need them to top off my surgical result. I use all to make the best result. So my advice is, as they say, how do you get to Carnegie Hall? Practice, practice, practice. My advice is to learn in this specialty. Never stop growing.
And come to listen to Jonathan Sykes and his academy, and come to TAMC, because you will pearls of wisdom from people's greats. Thank you so much, Jonathan. Thank you for coming once again. Let's have a great 3 years, and hopefully a great another 30 years of friendship.
Yeah.
And more than 30. I don't know why I said 30. Many more years.
Yeah, exactly.
Thank you, Jonathan.
Thank you, my friend.
Thank you so much for coming.
Thank you.
You're a great man. Thank you. That was Jonathan Sykes, guys.